Hi, today I'll be taking you through a case conference presentation of my client that I prescribe scientific evidence-based exercises to across a 6-week training program. The case profile. The male client, aged 20, had a body mass index of 26.7. We were not constrained by the client's aims while selecting the various exercise tests because the adult pre-exercise screening system did not show any risk factors. We did, however, bear in mind that my client's grandfather, who was 73 years old, had a family history of heart illness. His main goal was to return to the gym and improve his strength and power through compound exercises, in particular in regards to the function of a hitter in volleyball. His short-term goal was to get used to the gym again with the incorporation of compound movements in this 6-week training program. His long-term goal, however, was to see results in his strength and power while hitting during volleyball. Exercise plays a crucial role in achieving the goal by providing a structured approach to getting back into the gym and focusing on compound movements to increase strength and power. This will target multiple muscles simultaneously, leading to more efficient and effective exercises. This approach not only helped in rebuilding overall muscle strength and power, but also improved his stability, flexibility, and cardiovascular fitness, as well as frequent sessions with myself and established home programs made it easier to maintain consistency and tracking his progress, ultimately leading to significant improvements in physical fitness and performance. Testing and outcome measures. At the beginning of the 6-week program, we conducted several fitness tests. This included the YMCA cycle test, endurance push-up test, sit and reach, max plank, and lunge test. In the YMCA cycle test, my client's VO2 max was lower in pre-testing compared to the post-testing of the cycle test. As you can see in the table on the screen, my client's VO2 max increased by 0.12 milliliters per kilo per minute in load 3. While participating in the YMCA cycle test, the heart pumps more blood with every beat, which increases the oxygen extraction capability in my client, therefore improving his cardiovascular endurance. Hence, this is why I chose the YMCA cycle test. The test is important because it predicts cardiovascular fitness. Cardiovascular fitness is important for volleyball players like my client as it allows him to perform repetitive movements such as jumping, shifting quickly in various directions without experiencing fatigue. The endurance push-up test saw my client increase by 1. Both his pre and post results were in the range of very good according to figure 2. This test was important for my client as a push-up is a multi-joint exercise that works large muscle areas of the upper body. It is an added benefit of training for core stability, which is essential in developing strength and power for volleyball. The sit and reach test is important as it measures flexibility at the hamstring and lower back. My client improved in the sit and reach test. His initial result of 22 centimeters as an average fell in the moderate ranking for males, whereas his post-testing result, an average of 29 centimeters, fell in the good ranking for males between 16 to 24, as seen in figure 3. The lunge test is a great test to conduct with my client as it helps prevent any limitation or injury, as well as assessing where the client's dorsiflexion range of motion is at the ankle joint. My client improved his ankle mobility during the lunge test pre and post. His initial results of his left foot, 12.5 centimeters, and right foot were 10 centimeters. His post-test results of his left foot were 13 centimeters and right foot was 11 centimeters. According to the normative data in figure 5, he is in both rankings with his mobility. My client significantly improved his time for the max plank test. His pre-result was 1:30, which was considered an average ranking, compared to his post-test result, which was 2 minutes, which was still in an average ranking, according to Wood. However, the minutes obviously increased pre- and post-testing, which was great to see. The plank test measures the control and endurance of the back and core stabilizing muscles. This is beneficial for my client as it enhances stability and endurance while holding a plank position for extended periods of time. Exercise prescription. With my exercise prescription to my client, I kept in mind that he wanted to improve his power and strength with more compound exercises, interrogating squats, overhead press, deadlifts, dumbbell rows, and core exercises into my client's training program addresses the strength and power needs of volleyball. With many authors discussing, these exercises collectively enhance the lower and upper body strength, improve power output, and contribute to better performance in key volleyball skills. By focusing on these targeted exercises, my client can develop strength, power, and stability needed to excel in the sport, ensuring he performs at his best during games and training sessions. In this training program on the screen, it shows how I modified his warm-up and how we kept the same exercises across the 4 exercising weeks. In the warm-up program, I added a knee-to-wall and shoulder mobility with a band. In previous weeks, my client's ankles were slightly lifting off the ground. This was a component I researched. According to Academy of Sports, ankle mobility plays a vital role in keeping the heels down during squats. Stretching is a great way to increase ankle mobility and help maintain proper form while squatting. This increased his mobility in his ankle, which was seen to improve in his back squat and deadlift. Therefore, you can see how I've used this and applied this research in my design. The change in objective and subjective assessment measures were linked to my exercise prescription. The overhead press and double row improved his upper body strength, and it showed in the endurance push-up test. The squat and core stability exercises were improving each week, and this showed when he performed the sit and reach test at the end of the 6-week program, which increased by 3 centimeters. The deadlifts and squats were improving his mobility in his ankles, which was shown through the lunge test by increasing his mobility by 1 to 2 centimeters. By incorporating some core exercise at the end of the exercise program each week, saw an improvement to his max plank. He had increased his core strength and stability exercises, which was great to see as he increased his max plank time by 74 seconds, which was a major achievement. I kept the exercises the same over the 4-week program. However, I was stricter on his tempos as this is a major component of power. Using specific tempos in the exercise program effectively developed power by focusing on explosive concentric movements and controlled eccentric phases. Tailoring the tempo to his short and long-term goals ensured that he built necessary strength and neuromuscular adaptations to maximize power outputs. My client's perceived behaviors were lack of time and low motivation, and his actual barriers were busy schedule and physical fitness. This was discussed in the initial interview with him. With his lack of time and busy schedule, we introduced short and effective workout sessions, 30 to 45 minutes a day. Research shows that strength and power can provide similar benefits to longer sessions of moderate intensity exercise in less time. I provided a structured schedule that included shorter programs that can be done at his own gym or during breaks. During the initial consultation, I engaged with the client in a motivational interviewing session to understand his personal reasons for wanting to improve his fitness. By exploring the client's goals, I identified a desire to improve his strength and power, but also to improve his motivation. We set small achievable goals at the beginning, and once he started to gain confidence, we then in the gym made the goals slightly harder, which kept him motivated and saw an improvement in his physical fitness. Professional reflection. During the sessions, I did achieve some things. This included communication to the client, prescribing exercises that were relevant to the client's short and long-term goals, and practicing ethically and respectfully within the scope of exercise science. However, there were various strategies that were implemented that I could improve on. In the first week, I could have explained the exercises in better detail and had evidence-based papers to support what I prescribed for him. For instance, I asked the client if he wanted to do a bench laying down row or an elevated row. In fact, they both target different muscles. Research indicates that different rowing variations can target specific muscle groups and contribute to overall upper body strength and stability. I needed to be more explicit with what I wanted as a practitioner with what muscles I was wanting to target, and I therefore went with the dumbbell row on a flat bench. I increased sets for the warm-up to 2 sets and added ankle mobility exercises. Leg swings were also included to better prepare my client for the main compound lifts. Added ankle mobility exercises as this led to improvements in my client's squats and deadlift performance, with feet remaining planted on the ground. I could have also improved on using more cues to identify the error quickly. For example, plant feet into the ground. Towards the final weeks, I accepted some feedback from my supervisor, which I took on and used for the last 2 weeks. She said that I should use a watch instead of a phone for timing rest periods as it appears more professional and maintains focus during the session. This ensured that the rest periods were consistent of 90 seconds. To also keep the conversation with my client professional and making sure to ask him open-ended questions about the session. If I were to do this again and had another client, I would be more assertive in setting and enforcing rest periods to ensure a consistency of the training program, to continue to refine cueing techniques to correct form issues promptly, as well as being meticulous about technique, which ensures the client performs exercises safe and effectively. Lastly, to shift from broad questions about overall goals to more specific questions regarding any challenges the client is facing. And here are my references. Thank you.